probably the thing that I most want to talk about today is the Colorado Health Benefit Exchange. Last year, well, to begin with, one of the proposals to help make insurance more affordable that is required in the Affordable Care Act is that every state establish some kind of a health benefit exchange, which is a marketplace where insurance can be bought and sold. And it's also the place where people who are receiving subsidies based on their income, if their income is between Medicaid eligibility and 400% of poverty, there's some level of subsidy that they will receive from the federal government, and it's kind of a tax structure issue. So you don't receive the money directly, but the money it's paid to the insurance company on your behalf. But anyone who is purchasing insurance with that subsidy will be expected to purchase in the health exchange. Now, the idea of an exchange is not new. It's not new nationally or nor in Colorado. Actually, it was a concept that was introduced several years ago after Hillary and President Clinton's attempt to reform health care when President Clinton was in office. One of the proposals this came from a right-wing think tank, the Heritage Foundation, and they were proposing something akin to this exchange. Well, interestingly, when push came to shove, the Republicans didn't like the idea, but that was the root of the idea of the exchange. In Colorado, in 2008, the legislature established a Blue Ribbon Commission on Healthcare Reform. And I will proudly say, most people don't know it, but my predecessor in the Senate, Senator Deanna Hanna, was the one who actually proposed it, but she doesn't get a lot of credit because she left the Senate before the bill actually passed. But it was initially her legislation to create the 208 Commission. And this commission worked for 2 years and came out with some, I think 52 various recommendations for healthcare reform in the state, one of which was the idea of an exchange. Well, the legislature was not in a position to adopt the whole, all of the proposals that come from the commission. But under Governor Ritter, we worked at some of the building blocks and did a little part of those 52 ideas. And several of those have become law over time. One important piece was the Healthcare Affordability Act about 3 years ago. My retrieval system is not great anymore, so I don't always remember the years. But with that act, hospitals stepped forward and they said, all right, we are willing to put up some money up front in order to draw down a federal match, to match that money. And the idea was, at least on the hospital's part, is if more people come, and that way we could expand eligibility for Medicaid. So more people then would come into the healthcare system, into the hospital system, and they would have insurance. So the intent was to reduce the cost shifting that so often raises the price, the cost of healthcare. So the health benefit exchange was another idea. Currently, we still know that 1 in 6 Coloradans is uninsured, and that population continues to grow. And that roughly half the uninsured Americans are small business owners and their families and employees. So the exchange is designed to help actually individuals and the small businesses. So what is a health benefit exchange? It's It's an online marketplace for individuals and small employers probably the best example is an Expedia idea, Expedia notion, where you go online and you gather information about healthcare. The thing that makes these health benefit exchanges better than what's available right now in the private market is that you have the opportunity to compare information on cost, the cost of insurance, and the quality. The quality is key in this exchange that's being created now, because not only will you be able to compare the costs of insurance of the various policies, but you'll be able to compare, you know, if I buy this policy that costs me less, but I have a higher copay, as opposed to this policy over here where it costs me a little bit more, but my copay is lower, which is actually the better value. So you'll be able to ultimately compare and determine which is the best quality for your dollar. There's also a shop exchange, and the shop exchange is the place where small employers are able to go and shop and compare policies for their employees. So the shop will cover the groups of the small employees. The other thing that you'll be able to do in the health benefit exchange is determine upfront eligibility for public programs. So as one would enter the system, the system will go to a search engine, and with the information that you give them, will determine if you're eligible for Medicaid, in which case you'll be sent off to Medicaid, to the Medicaid system, without you having to do any more. You'll be directed appropriately. You won't have to fill out more paper again and again, or more forms. If you're not eligible for Medicaid and you are eligible to purchase in the exchange, then you'll be routed onto the exchange software to help you make your decisions. And then the Colorado Exchange has determined that there will be one umbrella Colorado Health Benefit Exchange, but within that there will be a separate operation of a shop exchange and an individual exchange. The other wonderful thing about the exchanges is that you will have the opportunity to sit down and talk to someone and maybe be coached and help through the process. These people are called navigators, and we're in the process of determining just who the navigators actually will be and how they will function. But then once all of that has happened, you can enroll in a plan right there on the exchange. In 2011, the legislature passed Senate Bill 200. And Senate Bill 200 was the bill that actually set up the exchange. It was a most interesting process. I was the prime Senate sponsor, and I came to the table with my idea of what the health benefit exchange could be. And meanwhile, in the House, every bill has to have a Senate sponsor and a House sponsor. And with our split legislature, it was really important that we get some Republican buy-in in the House. So Senator Amy Stevens had her idea of what an exchange should be. And there were a lot of places where this didn't mesh. But the two of us sat down and we worked for several months before the bill was actually even introduced to come to agreement on a bill that we could both carry. Even to the point of saying, you know, neither of us will accept amendments or be supportive of amendments that we don't agree upon. And that relationship was tested, the process was tested, but it worked. And in the end, the legislature did pass, and the governor signed in May 2011, the bill, the Colorado Health Benefit Exchange Act, which establishes the framework for the state exchange. The exchange is a quasi-governmental unit. It is not an agency of the government, which in some states is the way they've gone about it. They've created another department over here or something within their Medicaid agency or their health agency. This is a separate entity, and it's governed by a board of directors. The statute laid out who needs to be appointed to this board of directors. It includes people who know insurance, people from insurance. It includes people, medical people. It includes, let's see, people who know actuarial issues. There's a technology person, because this health benefit exchange is highly technical. Most of the money that will be spent will be initially spent on building a good system. Also, very importantly, includes people from the advocacy community who advocate for consumers who have a more difficult time with purchasing health care. And then it has three ex officio members. The head of the Medicaid agency, healthcare policy and financing is one. And these three are not related. The commissioner of insurance and the head of the economic development department in the governor's office. And in addition to this board, there is also created an some people call it the oversight committee. It's actually a legislative implementation review committee of 10 members of the legislature who have several tasks. One of which is to assure, to be the conduit for any legislative change that the board determines they should seek. Also, there are various things that this implementation committee needs to approve, like, probably most importantly and most important today is approval of grant requests. We met this week as an oversight committee, and both Representative McCann and Senator Aguilar joined me on that committee, and we are hopefully about to apply for our second level 1 planning grant, and that application is due fairly soon. And at this point in time, the oversight committee has met and discussed it, and there's also provision that if the chair, who this year is Representative Bob Gardner in the House, and the vice chair, myself, if those two approve the grant, it doesn't need to go back to the full committee. So hopefully that's what's going to happen next week, so that we can get this grant approved. But the mission of the exchange, bottom line, is to increase access, affordability, and choice for both the individuals and the employers who are purchasing health plans. The key features are that it's an open, competitive market, and I talked about the separate individual and small employer marketplaces, and the risk pools are also separate. Colorado has already hired a team of companies to build and integrate all of the systems that will be required. The board has been operating for more than 6 months now, and have reached many policy decisions. The exchange will share this new eligibility determination with public programs. It's called minimum operability. So it's not just the one system, it's the search engine that I talked about earlier, where the determination exists. If you come in through the Medicaid door, your information will be checked in the search engine. If you come in through the exchange door, it'll be checked there. But the intent is to create a situation where there's not a wrong door to get into the system. So that one search engine is the place where all of the eligibility information will exist. And I think the important thing is that throughout all of this process, there's been a very robust stakeholder process. when I do go to exchange board meetings, initially the room was packed. They could barely find a room big enough that met all of their needs in the state, and the audience has come down a bit, but it's huge interest. And there have been various work groups created, and these work groups have really very much complemented and assisted the work of the board in at least making recommendations, policy recommendations to the board. There have also been stakeholder meetings around the state. Lord knows how many there have been through the last year and a half, even as the legislation was being created. So that's kind of a thumbnail. If you want more information, they have a website, and you can go and follow what's gone on not only in the board, but also in all of the different work groups. That website is www.getcovered.co. Get Covered and then Colorado, so it's the .co.org. And their phone number is 720-496-2530. And I'm excited at the choice that was made of the executive director. She's a person who's has a lot of experience actually in the private sector, and she didn't come with a lot of legislative baggage, so she works well with the business community and the insurance community, as well as with the legislature. I think she's doing a great job. Her name is Patty Fontenot, and she would be happy to come out and talk to a town meeting sometime in the future if you want her. So happy to take questions. Probably we'll let Representative McCann speak first. Thank you.
So, 30 seconds to do a couple of things. First of all, we do have 4 seats up here. And if anyone is brave enough, I can actually move this back a little bit and we'll bring another one back here. So you don't have to sit right in front. And then, secondly, I want to introduce our guest, Representative Beth McCann. She represents House District 8, which is sort of northwest Colorado. Denver. Northeast Denver, sorry. Denver here. And she came here at great personal sacrifice. She got a speeding ticket. But I only want to bring forward is it's not true that your legislators get out of tickets. We have a living example here. And she's going to talk to you some about how the Affordable Care Act affects people on Medicare.
Thanks.